You have seen Mr. Doe and determined based on your history and physical examination that he likely has an acute congestive heart failure exacerbation. Now we'll go over how to clear the MSE note requirement. To clear the M under the event column, select Mr. Doe and choose the MSE button on the navigation bar. If you are planning on also writing a provider note, this does not need to be an exhaustive note. All you need to do is click if you're the screening or the definitive treatment provider. In this case, we are the definitive treatment provider for Mr. Doe. Say see chart for details, and click the green check mark to sign the form. Once that is done, you can see that the M has been cleared. Another thing that you should do early is consider what's called running interqual, which is a prompt for utilization review to review the patient's insurance status to see if they should be transferred and whether or not they meet predefined criteria for hospital admission based on their diagnosis. If you suspect that a patient may be admitted to the hospital, you should trigger this utilization review analysis by first clicking the Events button in the navigation bar, clicking Request Event, and then Interqual Request. It is brought up at this point in the video because this process takes time and you should do it before you're ready to admit the patient so it does not hold up your admission later on. Now it's time to order things for Mr. Doe. You might want to order some labs to rule out other diagnoses and place some medication orders. Let's learn how to do that. With Mr. Doe selected, click the Place Orders button on the navigation bar. If your account does not have access to this screen, such as may be the case with medical student logins, orders will have to be placed in a different fashion, which will be covered later in this video. The tabs across the top of the navigation bar give you access to different quick order screens customized for the Adult ED, Peds ED, Urgent Care, or Psych ED. Even if you are working in one area, you can use the screen for a different area to find the most appropriate order. For example, even if you're working in the Pediatric ED, you can use the Adult ED orders to order an adult medication dose. Be mindful that for weight-based dosing, as will be common in the Peds ED, the computer does not automatically stop at the maximum adult dose. Please double-check all orders before signature. The orders on the quick order page have been carefully selected to have the correct details for ED use. Order from the pick list whenever possible rather than searching for orders by name. The top labs area represents the most popular overall labs ordered. For Mr. Doe, we may want a CBC with differential, basic metabolic panel, and maybe a troponin. You can see less commonly ordered labs in the Labs tab below. Click on the arrow next to the text to expand the field. If you wanted to order a B-type natriuretic peptide or BNP, you can do so here. Each time you click an order, the green box at the top right of the screen will keep track of these pending orders until you are ready to sign. Top imaging has the most commonly ordered imaging. Here we probably want a 2-view chest x-ray for Mr. Doe, so let's order it here. Other imaging can be similarly ordered by expanding the arrow next to the text. For sites that upload the ED-based bedside ultrasounds to Synapse to our PACS system, please order the appropriate ultrasound under Provider Ultrasound, and consult providers in your facility for how to record the images. Let's order a bedside ultrasound to evaluate Mr. Doe for a pericardial effusion and to get a rough estimate of his ejection fraction. We can choose ED ultrasound cardiac echo by clinician. Formal ultrasounds done by ultrasound techs and read by radiologists are ordered using ultrasound radiology. New order entry is the location where you can order with your own specific medications, labs, or imaging that you may not find elsewhere on the quick order screen. Use this only if the order you want is not represented on the quick order screen. In this case, you have decided that Mr. Doe should receive some furosemide, or Lasix, for diuresis. Under Top Meds and IV, you don't see furosemide listed, so let's order it using the New Order entry bar. Type furosemide, and it will give you various options. Some options are already filled out based on common methods of administration and common doses. You can always modify these later, so choose the one that best describes your intended dose. I want to give Mr. Doe 20 milligrams of furosemide IV push stat, so I can choose this one here. If I wanted 40 milligrams, I could still choose that and later modify it before signing orders. I also want Mr. Doe to have strict intake and output, so I start typing the word strict and then see strict INO. You also want to give Mr. Doe 162 milligrams of chewable aspirin, but you see under Top Meds and IV that this is represented, so you decide to order it from the quick pick lists. Top Other has important things such as a 12-lead EKG, saline lock insert, oxygen therapy, and orders for specific kinds of monitoring. When we get to disposition of Mr. Doe, this is also where you will place the request for admit order if you would like to admit him, in order to place an observation if that's more appropriate, or the discharge patient order if Mr. Doe is ready to go home. If you are ready to sign your orders, click the green box where it will give you the option to sign or modify your orders. I always click modify here if I have more than 1 or 2 orders, so I can do a last review prior to final signature and make sure the orders are exactly how I want them. Choose modify. Your orders here are now listed for signature. If the orders are exactly how you want them, you can click the sign button. If you'd like to modify an order, such as giving 40 of furosemide, you can click the irrelevant order and change any parameters that you wish. If an order has insufficient information to be able to be signed, it will be denoted by a blue circle with a white X in it, seen here next to the chest X-ray. Before you're able to sign, you'll have to remove any of these signs. To do that, click the relevant order and see what further information it needs. Anything shaded yellow or marked with an asterisk is a requirement to fill out before order submission can occur. Now that I've written congestive heart failure, the yellow box is turned white and the marker saying that we have insufficient information for our order has gone, and now we're ready to sign our orders. Instead of individually choosing orders, you can also use order sets. There is an adult order sets drop-down list that you can choose from, or under new order entry, you can type in ED to see various order sets, or PED to see Pediatric Emergency Department order sets. Any order with a yellow square with shapes inside it is an order set. Let's practice the ED chest pain order set for Mr. Doe. Once the order set is open, you can use the checkmark boxes on the left to choose whatever items you want to order. You can use your own judgment on which items of the order set to include. Let's check aspirin to give Mr. Doe an aspirin. If you want to give nitroglycerin, check that box, and read the default dose to ensure it is what you want. In a similar fashion, you can check off all the labs and imaging you want. Once you're happy with all your orders in the order set, click Orders for Signature, and once you've cleared all the blue circles, you can sign your orders. From the Place Order screen, you can also order consults. Some consult services have a static service pager and are labeled as auto-paging, which means that once the order is placed, a page with the patient's name, medical record number, and your callback number will automatically be sent. Those that are labeled no auto-paging will not send a page, and you must separately page them through your hospital's paging system. In all cases, please order the consultation so the timing of your initial contact attempt can be documented in ORCID. For medical students or other providers who need to propose their orders for verification, the same orders are available, but the Quick Orders page unfortunately is not. Click on the Add Order button next to Review Orders, which will then bring up the following box. The shown folders represent each of the quick order menus we previously covered, and orders and order sets can be accessed either by typing their names in the search bar or by accessing the relevant folder. If you wanted to order an X-ray, as an example, you can type in XR chest, choose the appropriate 1-view or 2-view stat, or you could do it through the folders by clicking Adult ED Orders, then Top Imaging, and then the X-ray you wish to order. The folder with an up arrow on it moves back 1 folder level. Once you write an order, it will ask you to send it to the provider you are working with, usually a resident, for co-signature. Put in their name and submit your order as described previously in this section. Interns and unlicensed residents will use the same order proposal workflow when they write outpatient prescriptions. The Review Orders screen shown here is an area where you can see all orders that have been placed for a patient. This is helpful if you are unsure if you've already ordered a medication or test on your patient, or if they've already been screened by another provider and you want to see which orders have already been placed. We can easily verify here on this page that everything we intended to order has been successfully placed. Now that you've ordered all your studies, we'll next review how to view those results, including labs, imaging, and EKGs.